Welcome to the Unlimit podcast, brought to you by Bitcoin Unlimited. In this episode, I speak with Saqib Noor, orthopedic surgeon and founder of One Dot Surgery. Saqib is trying to disrupt the multi-billion-dollar scientific publishing industry, and he plans on using Bitcoin Cash to do it. To understand how cryptocurrency fits into that bigger picture, though, we first go over his history as a surgeon and his travels that highlighted the discrepancies between the quality of healthcare available in different parts of the world. If you get halfway through the podcast and are wondering, hey, isn't this a Bitcoin podcast? Don't worry, we're getting there. Saqib, thank you for joining me.
Thank you, John. It's a pleasure to be here.
So, to give our audience some context, could you first tell us a little bit about the history of the Dot Surgery project? What inspired you to bring it into existence?
That's a really good question, and it's a really complicated question actually, and requires a lot of context and a lot of background understanding of some global issues and some of my personal history. Based on my own personal history, I'm an orthopedic surgeon, and I qualified from medical school in the UK in 2004, and I've been training to be an orthopedic surgeon for over 10 plus years, fully qualifying in 2017. But as a young doctor, around 2008, I had an urge to travel and see different parts of the world and different healthcare systems, and I went to work in South Africa for a year. And what I saw there was a massive discrepancy in healthcare and a significant difference in poverty levels and pathology that patients were having in that part of the world compared to what I was used to, as a UK-based doctor. What I was seeing kind of inspired me to look further and travel further and see more. And I had the opportunity and very, very lucky to be involved in projects in Haiti after the earthquake in 2010, as well as another disaster in Pakistan in 2010 when the entire country was flooded. Um, I traveled to Cambodia and Ethiopia and Myanmar, and what I was learning in the following 10 years was um, just the awful pathology that you see in human beings who do not have access to surgical care. I can tell you some terrible stories, and some of them stay with me. And it's those stories that stay with me that inspired me to work on One Dot Surgery, and what keeps me going to this very day is things like in Haiti after the earthquake, we looked after a number of patients who'd been injured, and one particular woman had lost her husband, her children, her siblings, her parents, her home, and had a spinal cord injury, leaving her paralyzed. And you say goodbye to that person after meeting them and knowing them and looking after them for a few weeks, knowing that you probably never see that person again, but knowing that there is a responsibility that you've learnt on your journey that there is this difference in healthcare, and that story stays with you, and you may never see that human being again, but you are driven to try and make an impact. I've seen children with tumors the size of footballs. More recently, just a few years ago in Cambodia, there was a 40-year-old woman who works as a farmer. She's worked at a farm all her life, and she had what we call a clubfoot. A clubfoot is when your foot is slightly deformed inwards. It's a very easy pathology to treat when you're a baby, but when you're a little bit older, it's more difficult. And so this woman had lived with a clubfoot for 40 years working as a farmer, and she tells me that she'd never got married, she'd never had children because of this deformity. And so I asked her, why was it now at the age of 40 that you thought you'd get treatment? And she just said it was starting to hurt her too much and she couldn't work as a farmer. And these stories are everywhere. I mean, it's just it's insane what you see, and um, those stories have stayed with me, and those stories have made me determined to make a difference in whatever way I can. And there was two ways I thought I could make a difference. One was to learn as much as I could about the problem, and so for the past 10 years, despite training in surgery, I've been trying to learn about um, some of the problems, reading about it, doing additional degrees, diplomas in catastrophe medicine, trauma surgery, medical education, just to figure out, what was happening. And the second one was to become the best doctor that I could possibly become. Um, One thing I learned is when a patient has to walk for 3 days to come and see you, or queue for 8 hours to get a consultation, they have no choice in which person they see at the end of that queue. It could be a medical student, it could be a charlatan, it could be somebody who's untrained. I wanted to become the best, or at least a fully trained, surgeon as possible, and so I committed to a route of lifelong training, and 10 to 15 years later, I've kind of get to that point where I'm fully trained and ready to hopefully um, be involved in surgical practice in parts of the world where I can make an ethical difference, where at least I feel I'm trained trained as well as I can be. So that's my background. It doesn't really answer the question about what one surgery is and what global surgery is, but that's the second part of the story. Um, if you want me to continue, I can go about some of the other issues. So global surgery is a subsection of global health, um, and we've talked a little bit about some of the pathology, but global health is really the health of the world's population, and we know there's a massive poverty gap between sub-Saharan Africa, South America, large swathes of Asia, and the West. And the global health over the past 20, 30, 40 years has been concentrating on um, certain important topics. You'll know about this: nutrition, access to water, access to shelter, um, vaccines, infectious disease, malaria, TB, HIV, and all the investment and all the money has been going into these projects. And to be fair, that was the correct approach. But there was zero investment into surgery. Surgery was considered to be unaffordable. It's too expensive to be to run surgeries in these impoverished places. How can it be possible? And so surgery got zero investment, which meant that for the past 30, 40, 50 years, there was no surgery available in these populations. And in 2015, there was a Lancet commission, or sorry, maybe in 2013, a commission run by the Lancet studied what access to surgery people in the world had. And it came with the fact that 5 billion people in the world don't have access to surgery. That's a huge amount. That's 80% of the world. And what are we talking about when we're talking about access to surgery? We're talking about cesarean sections when um, you're having a prolonged labor and a mother or child can die because they don't have access to an operation that will save their lives. You're talking about the clubfoot that I talked about, getting hit by a car and not having your bones fixed, having a cleft lip, having a congenital heart problem that would save your life, um, but is not available. And so this commission, suddenly launched a new movement called global surgery, where people all over the world, going all the way from the UN, World Health Organization, to grassroots levels, have decided that this needs to be addressed. It's a complicated problem. There's facets to surgical care that um, require a lot of thought. It's not a simple case of 10 surgeons from the UK or America going on a little trip in a camp and going to sub-Saharan Africa and saying, I'm going to do 20 operations in a week and save some lives. That's not how it works. That's a rather kind of backward or unethical approach to care. What it needs is infrastructure. It needs supply chains. It needs industry. It needs human resources. There's training of local staff to be able to solve these problems. Doctors, surgeons, anaesthetists, obstetricians. It needs education. It needs research. And so this complex movement has developed, and it's diverse and it's beautiful. Harvard University, other great universities are involved, and places in sub-Saharan Africa are, developing to solve this problem. But it's complicated, and so this global surgery movement is there, and one surgery is a small part of it. It's the web, it's the web-based platform to try and collaborate, bring people together, solve web-based problems. You're not going to solve the infrastructure. You're not going to cure somebody's cancer by going to one dot surgery and um, helping that project. There's loads of amazing projects that do that. But one surgery is solving some of the web-based problems that can help unite the movement and help add equity. And I can give you a few good examples of work that we've done that has made big impacts. I was in Ethiopia, and a couple of the residents came up to me towards the end of my trip, and they said, "We want to use your logbook, your surgical logbook that we use in the UK as trainees." And what a logbook is, um, it's like your training history. It tells you how much operations you've done, what operations you've done, what you've learned from them, the complications. Because just like a pilot, you're not going to trust a pilot that's only flown 50 hours. You're not going to get in his plane or her plane. You're going to trust a pilot that's flown 50,000 miles or 50,000 hours. And so similarly, a logbook is your flight record. And you would have thought that's a pretty simple bit of software, but it's amazing. A lot of people just use written paper or Excel spreadsheets. And some parts of the world have nice logbooks. The UK has a good one. I went around and saw some of the other places I'd worked in because I was lucky enough to work in Australia and Canada, and I reviewed their logbooks. And some of the software is pretty bad. It's actually pretty appalling. And you kind of think, how can that be? So One Surgery designed a logbook that is free to access for any surgical training in the world, covers every surgical specialty, and it allows surgeons to train and keep their logbooks together. And it was amazing. I logged in, a couple months ago, and you could see cases being logged in Canada and Guyana and Zambia and Malaysia. And you think, well, that's pretty amazing. You're connecting these trainees and providing them an educational resource. Similarly, we've developed a course platform that educational material can be logged together, and trainers or surgeons can teach their students for free. You know, um, we we have a research index that collaborates and connects all the research that's going on throughout the world in various parts in obscure texts and pulls them out in the open and shares them. More clinically, I developed a project in Cambodia where there was a problem with electronic patient records. There wasn't any electronic patient records of any great worth, and organizing the surgical operating theatre schedules was a bit poor. So we developed a free or $100 system that would have cost hundreds of thousands, because electronic patient record systems are expensive, logbooks are expensive, research indexes are expensive, and we've produced it on a budget of, yeah, I don't even want to describe it. It's minimal, and we've produced software technology that's, I would argue, better than anything I've used or worked in healthcare industry, fit for purpose, and infinitely cheaper. And we have more projects to go. And so that's what we do. We're a web-based platform that's bringing people together, solving problems that we can over the web, and um, and advocating for improving surgical care. It's a long answer.
Well, I appreciate your taking the time to elaborate. So, could you talk maybe just a little bit before we move on about how one surgery has managed to provide these things at such low costs? Is it just a dedicated team? Are you doing something different? Are you just not skimming as much off the top as maybe all the for-profit industries are? How is that happening?
I think one I'm a, I've been a web designer for a long time in my as a hobby, since I was a 15-year-old, when in the 1990s, and GeoCities and AngelFire were the big thing. And so I've been designing websites for forever. It's a passion, as a hobby. And what I noticed, and during medical school, I used to freelance a little bit. And what I noticed as I, obviously went into the healthcare profession, is that a lot of the healthcare people, and probably in lots of other industries, don't quite understand tech as much as they could. And so they end up spending a lot of money on, outsourcing tech development to, tech companies, and pay quite extortionate rates when I realize that these things can be designed for a lot cheaper. But also, they're designed by tech specialists, and it's amazing. Sometimes you see software that's designed by great people, but who aren't the end users. And so, you end up with a user interface that's not quite right. It doesn't work for that particular organization. It's clunky. Some of the hospitals still, in the West, in the US and the UK, have, you know, DOS based or some really terrible software that's running their work. And so it was a combination of me having perhaps some insight into design, and using that to inspire others to help out. And based on the small team that we developed, we just worked hard, and we worked for free, because the solutions that we were creating, once it was created, the principle was that it must be low cost to run and maintain. So, for example, the the project in Cambodia, which I think would have, cost a tech company 50 to 100,000 to develop, was charged for $100 and lots of hard work, but it's still running 3 years later. I was always worried, I'm not a technical, I'm not a web, professional. I was always worried, is this going to work? Is this going to fall apart? I'm going to leave, and will these projects survive? And 3 years later, the system's running, and it's not only running, but it's doing stuff that other web software doesn't do. It does automated research. The guys can click a button and get outcomes of their data within a second, whereas normally any other hospital wouldn't be able to give you that data without months and months of data extraction and it's built into it. And so it's just a combination of design and passion and love, knowing that what solution you're providing will make a difference in people's lives, not directly, but very, very strongly indirectly. So that's how we do it.
Well, congratulations on the success you've had so far. That's great to hear, and it's obvious that you're passionate about it, and that's a huge percentage or a huge part of it, I'm sure. So you're currently running a Flipstarter campaign, which, for anyone unfamiliar, is a decentralized Bitcoin Cash crowdfunding tool. And on that page, you mention liberating a multi-billion-dollar scientific industry, and you also mention that in order to do it, you need a borderless, instant, minimal cost payment system. So could you tell us a little bit about how you plan to do that and what that industry is?
Right. And this came from my global surgical kind of insight, but it's a problem well beyond global surgery. It's a global health problem, and to be honest, it's an entire medical profession problem. We produce research as doctors, as scientists, and we do that for the sole purpose of improving our systems and our clinical care to get the outcomes better for our patients. That's what drives us. And we put hours and hours and hours of work into this. Sometimes you have research grants given by governments or non-government organizations to fund certain research questions. But a vast majority of it, certainly surgical research, it's done by doctors, junior doctors, professors working in their own time to answer clinical questions that will improve the lives of others. And so myself, I've done 20 to 30, research articles, working, hours, days, nights, weeks, months, to get these research articles out there, and you do it all without any payment. So it's kind of free work from our point of view, but it's what we feel is part of our vocation. So once this research article is created, and it takes a long, long time and a lot of energy, you write it all up and you submit it to a journal, and the journal correctly reviews it and says whether it meets a scientific standard, and they do that by peer review. They ask other scientists or people in your profession to review this piece of work and whether it meets standards to actually be published as a peer reviewed journal. And then it gets packaged and published and disseminated in different ways. The problem that the world is having, and in particular people in low and middle income countries, is paying for that is extortionate, I would say. There are multiple journals out there that charge a significant amount of money for the pleasure of publishing your research. We did a study with the One Surgery team just recently, just the last few months, and we haven't published it yet, but it's out there. We studied over the last 5 years the amount of articles that were published with global surgical themes. That means an article that came from a low or middle income country based on some surgical problem. And we studied the journals that had been published in, and the average article charge was about $3,000, $2,500 to $3,000 per article to publish that piece of work. And so that's a very high amount of money. And people are getting increasingly angry. Certainly, the global surgical movement and the global health movement are saying this is now unaffordable for any scientist in any part of the world to afford that. If you're earning $100 a month or $200 a month as part of your job as a doctor, and you get asked and then doing all the work to do the research with very little pay back for it, to get asked to pay that amount of money to publish your work, it's unobtainable. It's unaffordable. People are getting upset and angry, and it's not a solution anymore. So the Flip Starter is based on a new concept of changing that paradigm, because there's two major myths I think with research publication that I get asked a lot in question. One is, well, it can only be that expensive because it's a valuable thing that the journal is providing, right? They'll charge 3,000 because that's what it's worth. But if you break down what are the actual roles of the journal and what are the costs associated with it, you'll be incredibly surprised just how much of it is just profiteering. So there's three things that a journal I think does. One is um, it validates the science. That's one of the roles of the journal. Like I said, it peer reviews it and makes sure that this is a standard that can be disseminated. That's the most important process, I think, in journal publishing. And the irony of that is the peer review part is free because, again, it's the scientists that are peer reviewing. The journal doesn't pay for peer review. The journal will ask scientists, "Do you mind peer reviewing this article for us?" And us as scientists, as physicians, as doctors, will say, "Yeah, that's part of our inherent role as human beings as a or as scientists that we will peer review other people's work and we'll do it for free for the kind of credentials of being part of a research system." So the peer review is, I don't know any peer reviewer that's been paid, and maybe I'm wrong, but I get emails every day to peer review articles, and I don't see anybody saying, "Oh, we'll pay you 50% of that $3,000 that we're going to charge the researcher, or 10% or 2%." It's expected to be done for free. So the most valuable thing of the journal peer review is done for free. The second thing the journal does is it packages the article. Once it's accepted by the peer reviewer, it'll say, okay, we need to typeset it, we need to put it into PDF or audio format or into a printed journal. And so it packages the article into a disseminatable format. That, I would argue, is not $3,000 worth per article. And in fact, I would argue that with automated processes and being able to create PDFs by clicks of a button and using good design and CSS and even basic HTML, you can create some really nice looking professional um, software that will typeset for you. Yes, there'll be some editing, no doubt, but a lot of it can be automated. And then the last thing that the journal does is it disseminates. It's a responsibility to push that research as far as it can go, because we did the research to change people's lives or change the practice of people or surgeons or doctors. And once we do all the work to create it, surely someone else has to deliver it to the end user. And the journals don't really, I don't feel, do a great job with that. They get indexed in big indexes like PubMed, Google Scholar, Scopus, and other indices. But once you're established in these indices, the journal doesn't really pay much or contribute much to that process. And actually, they charge people to access some of that work. So in all three steps that the journal is doing, um, it's not really spending a lot of money. And what it's charging for is the branding and the impact factor and just the name of the journal, because of course the high name journals, if you if you publish in the New England Journal of Medicine or the Lancet um, or Nature, of course newspapers and other media outlets are going to pick up on that research and deliver it, and so you get paid for that. I think Nature Journal recently increased its fees to $8,500 to publish an article, and so you pay for that. That's what you're paying for. You're paying for the brand. But not, I don't think there's much more to it, personally. And I've tried to calculate it, and I've done the research and how much it costs to, be, produce research safely, make sure that it's indexed properly, make sure that it's archived in a manner that is accessible to the scientific community, because there's multiple different databases and ways that science has decided to um, connect all these dots. But I think it's a handful of dollars, personally. And I think that if you can create a high quality, low cost, peer reviewed journal, which is not easy. You still have to establish a brand and a reputation and an editorial board. But I think you can prove that you can disseminate science in a peer-reviewed format for a handful of dollars. $50, let's say. Give it a ballpark, $50. But that's still a cost. And the second major myth of the research industry, I think, is that science should be open access. Science should be free. Yes, in an ideal world, in a utopian society, everything is free, but science costs. It costs hours of work. It costs time for somebody to create the research in the first place. It costs time for peer review. It costs time for an editor to put it together and disseminate it. So there's always a cost. And it would be unsustainable to say you could create this journal and produce this amazing work and have it for free for everybody to access all across the world and it will work forever. It just won't. You need some form of income. And so the concept of the cryptocurrency and where I think is the most important part of it is once you put a price tag on that work, once you say this costs $50, $60, $100, who's going to pay for it? And the concept is that you use community crowdfunding to pay for it. So the journal publishes the article, says this article cost me $50, and you specify exactly where it costed you. What was the running cost of the website? What was the editorial cost? And this is where I want to change the paradigm, even pay the researcher to submit to your journal, and even pay the peer reviewer. It can be nominal. It can be $10 of Bitcoin Cash. It can be something to say, thank you for your time. Here's a token of our appreciation. $10 of Bitcoin Cash, $20, whatever. You create a system where there's money going back into the community. And let's say you end up with a fee of $50. You then publish that article and say this article costs $50. Who's going to pay for it? Well, the community pays for it in two ways. One, anybody in the world can access that article if they pay whatever the minimum fee will be. Let's say it's $1 to keep it simple. So I'm in sub-Saharan Africa. I see a research article that's relevant to me, and it's a $50 cost, but I pay $1 towards it, and I get that PDF on my doorstep if I pay $1 of Bitcoin, because you're not going to have $1 of PayPal in Ethiopia, or you're not going to have a credit card that's going to say here's $1. You say, hi, here's $1. I'll pay in Bitcoin Cash, 0.001 cent transaction fee, instant. I get that journal. I get the article, and the journal says, okay, I've had $1 come. Now my requirements are $49 left for me to recover my costs. And then the next researcher pays $1 as well, or $3, and whatever you can afford. So somebody in the US may say, look, $50 is nothing. I'll pay for the whole thing. Or a donor, the Bitcoin Cash community can say, look, this is an incredible global surgical article or a global, article on cardiac disease that I think everyone should read. I'm just going to pay the $50 and open it up. But dollar by dollar, you crowdfund each particular article, and as soon as it's crowdfunded to get to zero, the article becomes completely free to everybody. So it's community kind of powered, the community affordable, but everybody can chip in, which I think is the beauty of cryptocurrency, is that it's microtransactions combining everybody together. Anybody can access it. You don't need to have a specific monetary account. You just need a wallet and access to a computer and say, I need that research. And that's the model. It's not open access. It's community open or community owned. It's owned by the decentralized worldwide scientific community. We've paid for it. You've done the work, and now we're going to enjoy that research and we're going to build on it. And I think I have not seen a system like that. I think there is a value to cryptocurrency to it because I've been thinking of what if I had if we built this journal tomorrow, which is what we're trying to Flipstart for. Let's build this journal. Let's prove how low we can go. Let's go through the processes. Let's see how hard it is to get an ISSN number. Let's see how hard it is to design an exciting journal that meets the standards that you'd want. Let's say we did have it, and we had submissions, and we had a $50 tag on it. I was trying to think, well, how am I going to charge somebody in South Sudan or Venezuela or wherever to access it? How are they going to get it unless somebody in the US pays for it all? Or unless somebody donates it, how is that particular person going to have equal access to it? And that's with cryptocurrency. If you say, look, just pay me $1 of Bitcoin cash, you'll get the article and you'll help the community. I can't think of a payment system that helps. I'm not sure. I mean, I'm welcome to ideas. Like, I've thought about PayPal and Venmo and others, but it's not accessible to everybody all the time, and it's certainly high running costs for the journal. You want to keep your running costs as low as possible. So it needs to be a cryptocurrency powered payment system. That's what we need. I mean, there's no other. I can't think of a better solution than crypto to, and philosophy is well aligned. It's a decentralized payment system to help decentralize science, putting money back into the community, back into the scientific research world, and taking away the third party, which is the publisher that is extorting fees, or it's a multi. I mean, it's sometimes it's cringeworthy what you see. Um, so the philosophies, although slightly different, we use the crypto technology to power a science movement that opens up. That's it. That's what it is. That's the idea. That's what we're flip starting for, and it's not a lot. I mean, I don't think it's a lot. I've calculated it will cost, 43 Bitcoin Cash, or approximately, 10,000, let's say $10,000. Um, if you think that Nature charges $8,500 to produce one article, and they'll produce 20 or 30 articles a month, or other journals will charge you $3,000 for a scientist to publish one article. For $10,000, you could potentially create a journal that will allow people in the world to disseminate their work sustainably. But also, what I'm hoping to do is create a journal that is then um, replicatable. One of the major barriers is the tech world, like we've already talked about. Science and tech, or medics and tech, don't mix. If I want to create a journal tomorrow, I'll probably pay you, a couple $1,000. Can you just sort out, the platform? Can you make the make the website for me? Can you do all these type of things? Or I spend hours and hours and hours and months trying to figure out how to install, open journal software, and it's a real pain. So the idea is to create a journal that, at least from a one surgery point of view, we can manage it for you. Let's say tomorrow somebody wants to create a journal with the exact same model. We'll build it to the point where we'll host it and say, okay, it's your journal. We'll copy and paste our journal into your journal. We'll set it up for you. It'll take a day, nothing more. It shouldn't take a long time. You concentrate on the editorial board. You concentrate on the things that are important from the science point of view. Concentrate on and getting the submissions that are relevant and your processes, but don't worry about the tech. Just copy and paste ours. We'll have it for free. Our running costs will be the same, or maybe another couple of dollars a month to host it. Whatever it is, it's minimal. Um, but start working on the science, and then, in theory, if this system works, let's say it takes us a year to develop our journal. It'll take us a second year to develop 5 journals. It'll take us a third year to develop 50 journals, all powered by cryptocurrency. And all of a sudden, people in the world downloading wallets, spending $1, opening up research to to pass on science. And I just think it's just an incredible way to use cryptocurrency for some genuine, real change in the world, but also real good change. Like, you're disseminating science. You've seen what the world can do when we start working together. Vaccine created in 9 months. That's because everybody stopped charging. It's just like, let's just get this done. Let's reduce the barriers. And just imagine if science is flowing freely, dollar after dollar. Um, I don't know. I feel like it's a genuine use case. I feel like I can't find a better payment system, and I think it will just change some of the paradigms. It's a long shot. It's a small one surgery organization trying to take on a multi-billion dollar industry, and I'd love it if other people came out with ideas or models of journals that are similar. It doesn't have to be our journal. Let's say we create one for $10,000 or 40 BCH, but it's crappy. Let's say, I mean, we're not the best web designers in the world, um, but once the model is there, I think that I'd be very happy if other software designers say, look, we can create a better system. or not use your software because it's a bit, third party or it's a bit terrible, that's fine. Like just follow the model, use the cryptocurrency, disseminate the science, and change lives because ultimately that's what will happen. It's not the sexy thing of going around the world and operating on people, but you're giving people in the world the education to learn how to operate and to improve their skills. What can I say?
Sure. I think that this model that you've come up with highlights your understanding of the benefits of cryptocurrency, maybe better than a lot of people in the cryptocurrency space understand it. I mean, the borderless nature, the low fee nature of it, and how that benefits the people that will then have access to it that wouldn't otherwise. That at least personally, it makes me very optimistic about your project and excited about it. So let's talk a little bit about the specifics of the campaign itself. Now, it's going to be run in 2 phases. Is that right?
Right. So the first phase is, which is what we're doing right now, is just give just the resources to build a journal. So the resources required will be some manpower. It will require some genuine dedication um, to produce a low cost journal. There will be some technical involvement. There will be building together an editorial board, some marketing, some of the software that gets it working. Because there is software out there. There is Open Journal. So I forget the exact name. OJS. It's a free open source platform to create your own journal, and lots of thousands of companies or journals have done that. But I've looked into it, and it doesn't meet the standards that we'd need to create this kind of replicatable, cheap model that we want. So a lot of the funding will be to create the software, or at least the web tech behind it. Um, and so the first phase is to develop the journal and go through that process and learn about it. Because what you want to then to do is every step of the way, you want to be able to then document it so that if somebody wants to copy it, they just follow your model and they don't have to go through all the problems that you've gone through. So the first phase is to develop a low cost journal and put a price tag on what it comes at the end of it. What is your end? What is your how much did it cost to create that article? Like I said, I'm aiming for $50. It may end up being 100. It may be 2,000. We may be completely wrong, and it may be 3,000 to create an article. But I've got a feeling it's going to be a lot less. So the first part is to create the journal. The advantage to the Bitcoin community, I think, is firstly there's a vision there that could really become a use case, but also the worst case scenario is, let's say we create a journal and it's not that successful, or even the scientific or the medical or surgical community say, what are you doing? This is completely unacceptable for whatever reason. Um, the worst case scenario is that the Bitcoin Cash community can say that we've created the first crypto powered or crypto sponsored scientific journal. That in its own right, I think, is uh, a phenomenal achievement. The second part then says, well, how are we going to install the payment network? How are we going to actually talk about the $1 payments? How are we going to? It may be that we can just use. It may be that we can just use software that's already there, because I know there's e-commerce already installed into a lot of um, crypto payments. WooCommerce and WordPress and other places. You can just install a payment gateway, and all of a sudden you're taking Bitcoin Cash. And maybe that's all you need. But the second part would be consultation with maybe some of the Bitcoin technical experts and say, look, this is what we have. How do we ensure that our payment networks will work with the kind of crowdfunding model? We did some initial consultations and very rough, um, advice from some of the programmers, and charged or suggested it would cost, I can't remember, $10,000 to $15,000 or something. But stage two may be really cheap, or it may be a little bit more expensive. Um, but stage two is install the crypto network to allow us to accept payments smoothly. And I hope that'll be in a year, within a year.
So people can find the One Surgery project at one.surgery. That's the word one dot surgery, and that's the whole web address. And where can they? And they can also find your Flipstarter at flipstarter.one.surgery. Is that right?
Yeah. So I mean, we're the one dot surgery webpage won't link directly to the Flipstarter. Um, at the moment, we haven't really put a big banner on the front page saying here's our Flipstarter campaign, because it's still a novel thing to combine two communities. We have the global surgical community, the medical surgical field, who know nothing about cryptocurrency. I mean, I speak to fellows, peers, colleagues, and tell them about cryptocurrency, and we're too busy to know anything about it. It's a completely different world. We see it on the news, and we hear about $20,000 for a Bitcoin, and that's about as far as we've got. We haven't engaged in it, and it's too difficult. Um, and we're just busy with our other priorities. So combining that global world of surgery and medicine with the what I love is the BCH community, because I just think it's a much more decentralized, passionate, equal world that the BCH kind of promotes. We haven't combined those two yet. We've tweeted a lot about our project, about our Flipstarter, but we haven't really gone to the medical community to say, hey guys, this is what we're doing. But if we were to get crowdfunded for the first part, I think that would open up some of the channels of communication between our two worlds, and we'll say, hey guys, we're going to create a crypto powered journal. Why don't you learn about cryptocurrency? Because this is what it can do. And similarly, for the cryptocurrency world, who know nothing about global surgery and some of the problems that I've just described in terms of the heartache and the poverty and the impoverization of human beings that are struggling, I'd love for that world to know a little bit about ours. Um, it's important because we keep rattling the chain, but we keep tweeting to the same people, and we keep going to the same conferences, and it's a very closed world. And I think One Surgery can help combine the two, because there'll be experts within the crypto world that will be like, guys, there's better ways of doing this, or why don't we collaborate? And so I want to open the two worlds together. I chose Bitcoin Cash for a few reasons, because there are multiple currencies in crypto, and as an outsider, I own zero point 0.4 BCH. That's my entire portfolio. I don't know what everybody else is at, but as an outsider, it's just like a minefield. There's just thousands of stuff, and you try and read an article, and some crypto will say this is the best and that's the best. The reason why I chose Bitcoin Cash was, firstly, the branding is incredible. Um, I know of the problems of Bitcoin, and the debate of how useful it is, um, with the transaction costs, and also anything that's worth $19,000 or is 0.0000001. I wouldn't. It's just difficult. It's just difficult to imagine in your head. But the branding of Bitcoin Cash makes sense. When I try to explain to my colleagues what Bitcoin is and Bitcoin Cash, it's a lot easier to explain than any other crypto. Um, the decentralization part of it. I do have some colleagues and friends who are intimately related with the project, and they're the ones that introduced me to it. Um, I like the fact that you guys also took on a big industry in that sense. You guys challenged Bitcoin, from what I understand. You were like, hey, there's something not right here. We need to make a big change. We need to split. We need to do something that's going to sustain us. And I think that philosophy, or that strength that the Bitcoin Cash community had, is something that we need with this publishing problem. And so there's a lot of kind of parallels. Um, we could have, or we could have tried to crowdfund or find a donor in a different crypto sphere, or even gone to the medical and surgical industry and say, look, this is what we want to do. But there just felt like a genuine alignment with Bitcoin Cash. I may be wrong. We'll find out from this Flipstarter. We've tried hard to promote it in different various marketing campaigns and have fun with it, because we're not going to take it too seriously. it's a David versus Goliath that we're doing, and it was a David versus Goliath that Bitcoin Cash did. So we're not going to take it too seriously. We're going to try. If we don't get funded, we don't get funded. We'll solve this problem one way or the other. But that's why we've chosen Bitcoin Cash to go with it.
Well, I'm a little biased, but I do think it's a fantastic choice, and the Bitcoin Cash community is particularly enthusiastic about use cases, and you have provided, potentially one of the most disruptive use cases that's at least being presented seriously as a project that the community has the opportunity to fund. So I'll say I'm optimistic and also grateful for the fact that you've found us out, and there were people that were able to introduce you to the project. I think that's probably a good place for us to wrap up. Is there anything else you'd like to share with our audience before we finish up?
Just to say thanks. I appreciate that. What I've just talked about, and a lot of the ramblings that presenting on the Flipstarter campaign. People look at it and go, "I don't understand this. It doesn't make sense." It's a lot to take in. It's because it's taken me 15 years of working in a completely different industry to figure out this problem, and I wouldn't expect anybody who's not a healthcare professional to figure out what the relevance of all this is. It doesn't, and so any of the community that have taken the time to try and get some insight into the issues and understand that it's not a clinical project, but it's as relevant or more relevant than any clinical issue. It's just a thank you to those that are donated and who are taking the time to try and figure out the real world problems that different communities having.
Well, Saqib, thank you very much for taking the time to come on the Unlimited podcast. We wish you the best of luck with the Flipstarter campaign and with the One.Surgery project in general.
Thank you, John. I appreciate all your time.
And to our viewers, thanks for tuning in. Make sure to subscribe to Bitcoin Unlimited on YouTube and to look for this podcast on your favorite podcast distribution platform.